right. Thank you to the Minister through the Chair. And would the Minister be able to tell us, I guess, whether, I understand prescription drugs are covered, but are medical supplies, devices, any medical equipment, for example, diabetes test strips and syringes, would those be covered through this plan?
No, only drugs are covered under these plans.
Thank you to the Minister through the Chair. And for people who are in this position of not having insurance on their own, not being able to afford their medications, and I guess specifically to build on that example of people who have diabetes, is there another program through which they would be able to get coverage for medical equipment such as diabetes test strips?
So no, there is not. The option that we have for those struggling to meet those needs is to work with them through social development to see if that assistance can be provided.
Thank you to the Minister through the Chair. So this medical equipment that wouldn't be covered, there isn't another specific program. Social development may be able to help depending on their situation. And so I'll ask, even though I think I probably do know the answer based on the last question, but would other equipment such as flash glucose monitoring or continuous glucose monitoring, which is especially important for managing type 1 diabetes, would those types of things be covered through this plan or through another plan?
So not under these plans or any other plan that we have within government at this time. I can just refer to the program for children and the insulin pump program that is covered.
Thank you to the Minister. And one of the challenges, of course, is age, that some people are not eligible due to their age. But I do hear from constituents who struggle to pay for their medical supplies. Not just with diabetes, but type 1 diabetes comes up often, and so they pay quite a bit out of pocket, and sometimes they make decisions to basically they can't afford certain things. So they can't afford glucose monitoring, which can help with the preventative care and can actually improve health outcomes and when it comes down to it, save money for the healthcare system to have a more preventative approach. I guess I want to flag that it's an issue that medical supplies, medical equipment, which arguably is really important to managing health, similar to a prescription, and in some cases it says how much people need to intake for their medication. It's an issue that this is not covered. Would the Minister be able to tell us, I guess, are there any plans in terms of ensuring that there is coverage to ensure coverage of all people's medications and medical devices?
I have to agree with the member that there are certain aspects of management that can certainly benefit our healthcare system in the long run. And so what I can tell the member opposite today, Mr. Chair, is that I have been making inquiries, asking for briefings on some of these issues. Actually, diabetes strips was the big issue for me back a couple of years ago. Colostomy supplies, which also, I had a constituent who has since passed on that came to me in 2020 during the campaign and talked about the fact that she needed colostomy supplies and diabetes supplies through no fault of her own. It was, and she told me that on her pension, she said, it costs me over $50 to take a bath. And she said, so you can imagine how often I take a bath. And that was probably the most articulated way that anybody ever conveyed that to me as an elected person. So I would hear people say it's expensive, but just like catastrophic drugs, it's expensive relative to the individual. And so I have spoken about this before I was Minister of Health. I can promise you I've spoken to staff about it since becoming Minister of Health. COVID has taken us off the rails on some things that we want to initiate, but these are things that I promise you I am investigating, and I don't know how quickly we can come to a resolution, but I understand your perspective and not only appreciate it, I share probably a lot of that perspective with you. And so, so we'll keep proceeding with gathering information to see if we can make some progress in the future.
Thank you to the Minister through the Chair for that answer. Certainly, especially people with certain disabilities, people with certain chronic conditions, they definitely have added expenses that are not covered. And I've said this in the House before, and I'll say it again, that it's as if, we walk out of the hospital, okay, you're on your own. And yes, there are some programs, but they don't cover a lot of the things that are needed, whether that's colostomy supplies, whether that's supplies for managing diabetes, and there's a long list.